Today on Diabetes Connections Type 2, what you need to know about diabetes and your eyes. I know this one can make people nervous, but the most important thing to know is that treatments have changed a lot and they are much more effective than you might think. We'll also define the most common type of eye complication and explain retinopathy. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Hello and welcome to Diabetes Connections Type 2. I am your host, Stacey Sims, and I'm always so glad to have you here. Want to let you know that we are on YouTube now. I always say, find us wherever you listen to podcasts or wherever you get audio. And that's true. We are on every podcast platform except YouTube, which is one of the top podcast platforms. I know I don't listen to a lot of podcasts that way, but it's an amazing search engine and it's really growing strong when it comes to podcasting. So we are there now. There's a link in the show notes. You can also search Diabetes Connections Type 2 or Stacey Sims or search for the topic you're looking for. Although if you are searching by topic, please be careful. There's a lot of really bad information out there, unfortunately. And especially with a topic like this, you want to make sure you're getting the facts. So I'm really glad you weren't scared away by this topic. I know that eye stuff can be tough. I don't have diabetes, but when I was pregnant with my son, who is now 19, I had some of the warning signs of a detached retina. Luckily, I was okay. I didn't need to have surgery at the time, but they told me for the rest of your life, pretty much, we're going to have to keep an eye on this. So I have an intense eye exam every 2 years. And it is the kind of exam, if you've been through this, right? I have to take a deep breath and just do it. I get very nervous. But I tell myself, better that than letting it go and experiencing something worse. What I used to do in the olden days of Twitter, when the diabetes online community was super active there, is I would actually post when I was going to the eye doctor and ask people to kind of virtually hold my hand and get through it, and they were more than happy to do it. So, we don't really have that connecting place, but feel free to come into Diabetes Connections, the group, or tag me on Instagram. If you're going through an intense eye exam, maybe keep the pictures to yourself, but share with us and we can kind of be there with you because you do not want to put this stuff off. Now, admittedly, what I have is different from diabetic retinopathy. So let's take a minute and define what that actually is. Retinopathy is a microvascular complication of diabetes, which means it involves the small blood vessels throughout the retina in the back of the eye. So in medical terms, you probably know this, apathy basically means disease of. So retinopathy is disease of the retina. Now, the retina tissue is very sensitive to light. It's filled with millions of cells. If you've learned about the eye, this is where the cones and the rods come in. But these cells send visual information to your brain. This lets you see. Retinopathy is usually caused by persistently high blood glucose levels. So damage starts when the glucose actually blocks blood vessels that go to your retina, pretty much starving them. Symptoms can include blurred vision, distorted vision, seeing a lot of floaters, loss of vision, which is what happened to my guest today. And he's fine now, but you'll hear about that in a couple of minutes. Unfortunately, you can have retinopathy even if you aren't experiencing any of these symptoms. So eye exams are super important. This information comes from the American Diabetes Association, and I will link it up in the show notes. Our conversation this week is a little bit different because it first aired on my original podcast, Diabetes Connections, which is geared for people with type 1 diabetes. But the information is great and is largely the same, so I think it's great for you to hear it. But the family I'm talking to is a father and a daughter who both have type 1. Randall Barker, his daughter Emma, were diagnosed at the same age. There are a few more coincidences there between them. And we are joined by Dr. Laura Hieronymus, Vice President of Healthcare Programs for the American Diabetes Association. Randall's a great person to talk about eye health. He had a very big scare. He went through all the, I think, terrifying eye exams and treatments, and he came out the other side saying, that wasn't so bad, and he's doing fine. So spoiler alert, I hope I didn't ruin the interview for you, and it is coming up next. US Med sets the bar high when it comes to diabetes care. US Med excels in customer satisfaction, ranking number 1 in Dexcom customer surveys. And online, they're number 1 in Google and Facebook customer ratings among large national diabetes DMEs. With over 1 million satisfied diabetes customers since 1996, they've perfected the art of delivering better service and better care. From insulin pumps to diabetes testing supplies and the latest CGMs like Freestyle Libre 2, And the Dexcom G6, they've got you covered. Plus, they accept Medicare nationwide and collaborate with over 800 private insurers. US Med, your trusted partner in diabetes care. Your health, satisfaction, and peace of mind are their priority. Visit usmed.com/Stacy. That's usmed.com/STACEY. Randall and Emma and Laura, thank you so much for joining me tonight. I really appreciate you making the time.
Glad to be here.
Thank you so much for having us.
Yes, thank you.
So, Laura, we're going to talk to you a lot about the programs and about what's going on at the ADA. But Randall and Emma, let me start with you. You have an unusual story, not so much that you are a father and daughter with type 1, but in a few coincidences, if I can put it that way. Randall, let me start with you. Can you tell your story? And Emma, feel free to chime in if your dad gets stuff wrong or anything.
Of course. So my name's Randall Barker, and I was diagnosed with type 1 diabetes at age 10. What I was saying is that Emma and I, we both had eerie coincidences in our diagnosis, in that we were both diagnosed at age 10. Neither one of us had symptoms, and both of us were caught by random doctor appointments. Me specifically, I was actually caught on a pre-physical to attend a summer camp for Boy Scouts. And they did a check for sugar in the urine. And as we all know, if that's high, that's generally a sign of elevated blood sugars. And so we had it, moved forward to the glucose tolerance test, and everything from there was a diagnosis. And that was the beginning of my type 1 journey.
Emma, how were you diagnosed? Also at age 10.
Yes, at age 10, kind of like my dad said it, we thought I had the flu or something. It was the time of year where like everyone was getting sick. So I was sick. We went to the doctors and, they ran some tests. And I think like at the end of the doctor's appointment, they were thinking I had like a UTI. So me and my mom were actually leaving, and a doctor or one of the nurses ran up to us and she was like, "Hey, let's do like a urine test real quick, just, make sure everything's okay." So we did that, and, I had sugar in my urine. So then we went from there more into that.
Yeah. Randall, when I talk to adults with type 1, parents, this is one of their worst fears. I know it was really 10 years ago now, so you guys have obviously done very well, and I'm sure that you've moved through a lot of emotions, but what was it like for you at the time?
It was hard because you have that first thing that popped into my mind was guilt of like, did I miss something where, I would preach those textbook symptoms of diabetes. And, that was the thing was there something I had missed? And it really wasn't. She was just not yet symptomatic. I believe once we did her fasting glucose after that, her A1C really wasn't that elevated, and her blood sugar probably was maybe in the 400s, which, of course is an elevated blood sugar, but it wasn't, kind of like the horror stories of DKA where it's off the charts and hospitalization and so forth. So the first thing was guilt, but that kind of morphed into a little bit of relief because I was thinking to myself, well, I know what she's about to go through. I've had experience with this, and this can just be a hurdle that we can get through and jump over.
Emma, I'm curious, as the 10-year-old, as a little girl who had known that her dad had type 1 for all that time, do you remember what you were thinking?
In the beginning, I thought it was kind of cool. I was like, yeah, I'm going to be just like dad. But I was kind of shocked, but, kind of like my dad said, I was really relieved I had him to fall back on. And, he's been through this before, so I can always turn to him and be like, hey, I need support. And he'll be right there supporting me.
Wow, I love it. All right, well, we are here to talk about many things, but also to talk about eye health. Laura, thanks for joining us. There's so many issues we could be talking about when it comes to Diabetes Awareness Month, and certainly this audience is aware of diabetes all year round. What's the message for people like my audience who, some of whom have lived with diabetes for, more than 50 years? What do you want them to know right now?
Well, I think since the topic this evening is on eye health, we really want people to understand how important it is to have regular eye exams. For diabetes-related eye diseases such as retinopathy, macular edema, glaucoma, and cataracts. Now, it's not inevitable that someone with diabetes is going to get one or more of those eye-related issues. But what's important to understand is that we can prevent those, and we can treat them early on and be very successful in preserving eye health. Diabetes is the leading cause of new cases of blindness in adults aged 18 to 64 years. So we really want to push, if you will, especially this month, in the importance of those regular annual eye examinations. And it should be a comprehensive, dilated eye examination.
I think one of the things that may come to mind, when you say it's the leading cause of blindness like that, it's so scary and it seems so devastating. I think a lot of people don't get the exams because they're scared. Can you talk a little bit about how things have gotten better?
So we have a number of tools that we use. And first off, I'd just like to say that individuals with type 1 diabetes should have a comprehensive dilated eye exam within 5 years of diagnosis. Individuals with type 2 diabetes, because many times they've already had underlying prediabetes that maybe they weren't aware of, or even had type 2 diabetes for a window of time that they weren't aware of it, the annual or the comprehensive dilated eye exam is recommended at diagnosis or soon after. So that's the first, what we call the baseline exam. And that sort of tells us where that individual is in terms of their eyes. One of the things that I like to counsel patients on, because I have a background in diabetes care and education as a specialist, I like to counsel individuals to say to them, what you want is to go for your eye exam and you want to get good results. But that doesn't mean that you don't go back, because each year or so that you return for your comprehensive dilated eye examination, you're going to get more information. So if you know what it looked like last year and you're back this year, this calendar year, and you know what it looks like, you can really follow what those eyes look like in the back of the eye. You can see if there's any changes. The key to treatment, whether it's laser therapy or we have a new medication called antivascular endothelial growth factor treatment, anti-VEGF for short. And it's almost like a treatment that really preserves the eye. It helps protect the eye when the eye is treated with that medication. So, I'm saying that because you won't know if you need some of that to help prevent more devastating eye disease unless you go and unless you're treated. The treatments can make a world of difference and preserve eye health.
And Randall, so you as you're listening, I'm sure you're thinking, yep, I've been there, because you've been diagnosed with diabetic retinopathy, right?
Yes. So going back, I was probably diagnosed in the early 2000s when I was in college. And the basis of that diagnosis was there were some dot hemorrhages in the back of the eye that popped up. So from that point forward, I would do the yearly exams and would get the dilated exams. And we would keep, like Laura said, we could compare those images year after year after year. And I recall my physician saying, we're kind of in a holding pattern. These hemorrhages are not getting worse. And I want to say it was kind of even, the words were said once that it was a wait and see of what may happen, may not. Let's fast forward to 2017 when I had my first, what I say, big complication of retinopathy, where I had those hemorrhages actually ruptured and led to me having to have my first surgery for diabetic retinopathy.
All right, I have dumb questions here. Does that hurt? I mean, obviously you know something is wrong, but what is it? What happened?
It doesn't hurt that let me get to what happened. I woke up and, usually how you rub your eyes in the morning and everything kind of comes into focus. Well, this was in my right eye. I just had a blurry blob that would not go away. And as the day progressed, the blob progressed and got bigger and bigger until it kind of filled in the lower, I say 80% of the field of vision to where I could just see the top part out of the eye. It didn't hurt. At first I thought, oh, I've torn my contact maybe. No, as it got progressively worse during the day, I was like, no, this is not a torn contact. This is something else.
And that led you to surgery?
Yes. So the next thing was, of course, immediately got to my ophthalmologist. They did the full exam, was like, yeah, we've got, and it was actually, I want to say, out of the hands of them. They had to refer me to a retinal specialist. And it was there that they did a full exam and called what the hemorrhage ruptured, which led to the retina detaching and fluid filling in the eye. And that was what was causing the blurry vision. And so the treatment, of course, was to have a surgical procedure, which was done. I think it was scheduled for probably 2 weeks later. And I have to say, those were the longest 2 weeks of just blurry vision and more of just the fear of what if, and so forth.
What did happen? How are you doing now? I want to tell you about AG1, the daily foundational nutrition supplement that supports whole body health. It makes me feel like I'm doing something good for my body, right? I'm giving it the nutrition it craves. AG1 is a science-driven formulation of vitamins, probiotics, and whole food-sourced nutrients. It helps you build your health foundation first. I get the travel packs, so I don't have to miss a day, and it just tastes great. If you want to take ownership of your health, it starts with AG1. Try AG1 and get a free 1-year supply of vitamin D and 5 free AG1 travel packs with your first purchase. Go to drinkag1.com/Stacy. That's drinkag1.com/STACEY. Check it out.
Oh, doing great. So that was the call of really to putting focus of getting these really comprehensive exams done. Although I was getting dilated exams done yearly, they were, I guess, what you would call basic exams. And now I get more thorough dilated exams. The easiest way I can explain that is the exams before, when they would dilate my eyes, I'd be dilated for an hour or two and my vision's back to normal if you've had dilated eye exams before. After these exams, my eyes, it usually takes 6-7 hours for the vision to get back. I mean, they really get in there and do some very in-depth scans of the eye to be able to check out everything. So we had the surgery done. And at the same time, while doing that, we also we did an exam of the left eye as well, which led to more preventative laser treatments, as well as, it kind of makes me wonder if it's the injections and stuff that Laura was touching on. I don't recall the name of them, but I do recall, having eye injections that were more of a preventative measure for my left eye.
I don't have diabetes, but I'm extremely nearsighted. And so some of that puts me at more risk. I don't know if it's just the vision or just the anatomy of my eye for detached retina. And I had a scare when I was pregnant with Benny, of all things. So ever since then, I've had these in-depth eye exams. And yes, they are very different. And I got to tell you, Randall, I get completely stressed out before I do that because your eye is dilated and they take a lot of pictures. And a lot of it, every year the technology gets better and better. But there's something about our eyes, right? I don't care. You can take my blood pressure all day long. But oh my gosh, when they get so close and they're like, even that, is it the glaucoma test where it's just it's quick. So I guess what I'm asking is, can you give us some reassurance that these in-depth exams and the stress that they bring, they're worth it, right?
Oh, they're definitely, because they are stressful because it's your vision. It's not like another body part where you may have two of them or something of that nature. You have two eyes, but they're not easily replaceable. But yeah, the exams are comprehensive and stressful, but they're not painful. That's not the thing.
Yeah, that's true.
Yeah.
It's just tough to have somebody so close to my eyeball.
Yeah. And probably the most stressful part of these, seriously, when they were doing some of the images and they tell you not to blink and you feel like at that point you have to blink 50 times.
Right.
And that's probably the most stressful part is like, don't blink, but don't tell me that. Because see, now can I just hold my eye open? Because I'm going to try to blink.
Emma, when your dad was going through all of this, I know you're really concerned about him. Any thoughts for what you were going through, right? I mean, I imagine part of you was thinking, is this my future?
Yeah, I definitely started thinking about how I was, treating myself, like how I was doing with my diabetes, like managing my blood sugars a little bit better and kind of thinking about instead of laying something off like, oh, I have a high glucose or whatever, I would get more in action with it, I guess.
Yeah, that makes sense. I understand what you mean. Laura, actually, Emma, let me ask you a follow-up on that. Were you scared for your dad?
Oh, I was terrified. I'm not going to lie, but having my dad, he's very, likes to make jokes, look at things on the better side. So he was, laughing through it and had a really good attitude along with it. Now, there were times he was a little sassy, but I would be too if I had to go under 2 eye surgeries. But no, he did pretty good. And it reassured me that everything was going to be okay with him.
Had you already been having eye exams? I mean, you're very young.
Yes. Yeah. Right. Kind of like when I did get diagnosis, when, I would start seeing that eye doctor at least twice or more a year. So I saw him quite frequently, actually. And I also do wear contacts and glasses. And I have a problem with losing my glasses a lot. So I'm pretty familiar with the eye doctors. They're pretty familiar with me.
Laura, let me ask you, you mentioned that in addition to your credentials with the American Diabetes Association, that you are you're not only a diabetes educator, and you're not only an ADCES, you have been the Diabetes Educator of the Year. I'd love to get your take on, what do you talk to your patients about? Because as you've heard all three of us say, eyes are scary. These exams are scary. I get stressed out. What do you talk to your patients about to either reassure them or to make sure that they understand the importance?
That's a really good question. I think, we often hear that the eyes are the windows to the world. And so they are very important to us in order to see, to experience, to learn and grow. So they are really important. And I think for an individual, it's good for me as a diabetes care and education specialist, which formerly was called diabetes educator, to really ask, what are your concerns? What do you want to know about eye exams? What's important to you? How can I help you learn? And when you ask those questions, you often get a variety of answers and thoughts. But most people can sometimes get very distressed about the thought, even early on, that they may lose their vision, or they may have experienced that with a relative in the past. So I think up front, it's really important to walk through, what the eye looks like, how to really improve your chances or lower your risks of developing diabetes-related eye disease. And a number of things that you can do. One is time in target or time in range, optimal time in range, as much as possible for your blood glucose levels. That's key. Blood pressure, as well as lipid or blood fats control or optimal values there. So, really looking at all of that in addition to those regular annual comprehensive dilated eye exams. Really just emphasizing early detection, timely treatment, and that follow-up care can reduce the risk of vision loss from diabetes-related eye disease by 95%.
What I was going to ask was, in the research that I've done, it looks like the risk of blindness, the risk of eye issues, has really been reduced over the last 20, 25, 30 years. People with diabetes, they were told, diagnosed years ago that, it was inevitable, and now it's not. Can you speak to that?
It's not. I can. And I think it has to do with education, not only for individuals with diabetes, but also for healthcare professionals, helping them understand the importance of working together. So the primary care provider, the endocrinologist, the ophthalmologist, the optometrist, really working to ensure that that patient from a number of different avenues and recommendations gets their eyes checked. And so I think driving that change to reduce the levels of diabetes-related eye disease and really decrease the diabetes burden lives with all of us as a collective group.
Randall and Emma, let me put you a little bit on the spot because I appreciate everything you've had to say here about eye health, and it's so important. But while I've got you, your daughter, Randall, is 20, and my son is almost 18. How are you doing with the whole letting go part? Is that something that you've already accomplished? Is this smooth sailing? Any advice for parents like me who are, Benny's a senior in high school. He's about to go to college, most likely definitely out of town, if not out of state.
That's hard. That is a hard one, especially when I joke with Emma, who, like you said, is 20, and she still kind of depends on me a lot for helping her with I say simple diabetes things of making sure she's got a supply of supplies, that she has enough Dexcom sensors or enough insulin where she's living. She's off at college and lives, with roommates. And so, that's one of our constant conversations is, hey, how's your supply list going? But yeah, that's a tough one that you have to just almost take that leap of faith that you've raised your child the best as possible and given him or her those tools that they need. Yeah, that's tough though to let go.
Emma, what do you say to that?
Well, we live in the same city still, so I think I see my dad almost every day, honestly.
Nice.
So I think it's, pretty easy. I mean, sometimes it is hard. I mean, I do miss my dad sometimes. I mean, he's my dad. So, if I do start missing him, I'll just randomly call him, or he also lives about 20 minutes away. So sometimes I'll just get in the car and go over and bug him a little. But, I think we have a good communication. I feel like we're always talking every day, whether it's about diabetes or what I ate today for school or something like that. So, I feel like we have a good relationship and it's pretty nice.
One thing I'll add, and a lot of people in our local area and so forth, they'll reach out to me for my experience. And I try not to come off too, I don't know if the word is arrogant about it, but I try to really explain to parents that have those to not be that helicopter parent. You find this not just with diabetes now, but you find this in other conversations that things were different back then versus how they are now. And I think that's kind of one of maybe the negatives of technology is that it almost gives parents a little too much insight to their child's diabetes. And that almost gives a crutch to the child. That where in the old days of when I grew up, back when I was young,
20 years ago,
we didn't have those tools of CGMs and Dexcom Follow where I'm following her blood sugar. And so I feel like that puts a crutch on a lot of diabetics, people with diabetes growing up now, children especially, that they maybe become too dependent on those parents, or that those parents have a hard time letting go of that little bit of control. And I understand that it's love for the child. They have
scary.
this diagnosis, but at the same time, it's like they've got to leave and they've got to be adults at some point, if all that makes sense.
Oh, it makes perfect sense. We're having a lot of conversation in this house right now. I am leaning towards not following Benny on his Dexcom when he goes to college, but we're trying to figure out what exactly that looks like, especially during that transitional first couple of weeks, making sure that his roommate is cool with everything.
Yes. And I think that's a big thing. I think if they have a support system with them, roommates that are at least conscious of how serious this is, then
it's
that is a very good conversation that needs to be had.
Was that Emma starting to say something?
Oh, I was just saying, with my roommates, it's pretty beneficial that, I kind of sat him down and I told him, hey, I have diabetes, and kind of just gave him the spill about everything. And I think, being open with your roommates and the people you're living with about your disease, it really does help a lot because it gives the parents, some sense of a peace of mind and, about letting their child go. So I think just talking to them about it really helps.
You guys are doing great. As you start to wrap up here, Laura, was there anything you wanted to say? I know I'm sorry, I keep sidelining you, but I'm getting advice over here from this family. Is there anything that you wanted to say that I didn't bring up?
Well, I think that I liked the conversation. And one of the things that I've thought of, having been in diabetes care and education, I want to say forever, it feels like that. And it has been a long, long time, over 35 years. That piece about going off to college, leaving the nest, whatever, it's really important to have a good transition plan for that individual, that young person with diabetes, from what could be the pediatric endocrinology setting to the adult endocrinology setting. And really, the whole family needs to be involved with that, so that you're working through what kinds of things to think about, what kinds of things to do, how to work together, and how to maybe not helicopter as a parent so much. And so I think, all of that is really important. And that transition doesn't start when they're 18. It starts earlier, when they're young in early high school, to start thinking about those things and what works best for that young person. So that transition plan is really important. And then keeping up with the pieces and parts of the diabetes care plan, again, including the eye examination and making sure that gets done. And so I think, that's just something that's key and very important. If listeners out there are interested in sort of what's my risk of diabetes-related eye disease, we have a retinopathy risk test online. Very simple. You go online, you just answer the questions, and it gives you sort of an idea and a risk level for retinopathy.
Randall and Emma, I will give you the last word. Randall, you said at the very beginning here that when Emma was diagnosed, you did feel some guilt. I think that's totally natural. We can all understand that. But what are you feeling now about her? 10 years later, looking at your daughter, independent, except maybe ordering supplies. How are you feeling these days?
Oh, I couldn't be more proud of her and how she has handled her diabetes and her diagnosis. She hasn't been the poster child, but yet she has handled every obstacle that has been thrown her way. And she does go off on her own path. Absolutely does not do things the way I did them. As well, she doesn't do them the way that her other friends that are type 1, because she has numerous friends that are also type 1 from summer camp. And they all have their own ways of doing things. But I don't worry that she's going to have an issue as far as of just handling her diabetes. And when, forbid, these complications step up, that'll just be another little hurdle that I'm sure she's going to be able to jump over and get through to the next one.
And Emma, I'm kind of setting you up here, but when you're looking at your dad, knowing he was diagnosed the same age as you, what do you think about how he's doing?
I think he's doing pretty good. I mean, hearing stories from back when, he was a child and he was my age, and how he had really different life experiences than me. And, it's really nice to have that person to fall back on, so I can always ask anything, and I can ask him something, and 9 out of 10, he probably has an answer for it. And he's probably went through the same thing I did. So I'm really proud of my dad. And I really look up to him a lot. He's a huge inspiration for me. He kind of, motivates me to put my diabetes out there, and motivates me to do better and take better care of myself as well.
Well, Randall, you and I have known each other on social media for years. It's so nice to finally talk to you. Thank you so much for coming on the show, for bringing Emma along. And Laura, thank you so much for sharing such valuable information. I appreciate everybody just having such a great conversation. Thank you.
Yeah, absolutely. Again, you've said we've known each other from social media and conferences and stuff. And so, yeah, absolutely enjoy doing this podcast with you.
Absolutely. And thank you for having me.
Oh my gosh, I forgot I met you in person. I'm such an idiot.
Yeah, we met at Friends for Life.
Yep. I have no brain anymore. More information in the show notes about the American Diabetes Association programs, more information about retinopathy, as I mentioned before the interview, and other information that you may find helpful when it comes to your eye health. Quick housekeeping note, along with being on YouTube, our first newsletter went out. So if you didn't get that, and it had a paid study in it, by the way, It had information about our friends at Savvy Cooperative. I work with them quite a bit. They are looking for people with type 2 diabetes. So please sign up for the newsletter if you'd like more stuff like that. Right now, I'm only sending it out once a month. I don't want to jam up your inbox. But if I have anything important or if there's something really time sensitive, I'll put it out more frequently than that. You can sign up. There is a link in the show notes as well. And also over at diabetes-connections.com, just click on the Type 2 show. I also have some information out on social media. Facebook or Instagram are the best places to find me. Although I am now on Threads and I'm on LinkedIn, but I am not on TikTok. I'm not on Snapchat. All right, if you like what you hear, please share Diabetes Connections Type 2 with a friend. Thrilled with how this show is growing, and I hope you're finding helpful and positive information. Thanks as always to my editor, John Buchanan from Audio Editing Solutions, and thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.